For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Thank you all for joining us, and thank you to those who are watching also on Facebook Live. We have a lot of material to cover today. Some of it's complex and a little nuanced, and appreciate your hard work and diligence in being attentive to all of that. I also want to thank up front the media. We learn something new about COVID-19 every single day. And you all have done just an outstanding job keeping all of us informed about the latest developments, about the latest activities, and the latest science. And that's so important and critical during this public health crisis. So thank you for that, and thank you for taking this complicated material that's changing continuously and making it accessible to as many as possible. I also want to introduce Dr. Sara Cody, County Health Officer, and President Cindy Chavez of the Board of Supervisors, who will be speaking after me. I also want to acknowledge the rest of the Board of Supervisors, Supervisor Dave Cortese, Supervisor Mike Wasserman, Supervisor Susan Ellenberg, Supervisor Joe Simidian, who are practicing social distancing. Dr. Cody will be talking in a moment about the extension of the local health officer's shelter-in-place order. She'll also be talking about COVID-19 indicators that the Bay Area health officers have developed together jointly. But I will begin with some information on this new order. Today, the 7 Bay Area health officers have extended the shelter-in-place orders. This new order will take effect on Monday, May 4th, and run through May 31st. Again, the current order remains in effect until Monday, and it is from Monday that the new order's provisions take effect. The new order largely keeps the current restrictions and structure in place, so that means we will have to continue to together shelter in place to help combat COVID-19. As Dr. Cody will explain further, this remains essential at this time and at this stage in dealing with this pandemic. But the new order will also allow certain activities to resume beginning on Monday. The most significant of these changes is that all construction that is allowed under the state's shelter order will now be able to resume. But construction activities that resume must comply with a set of project safety protocols. And there's a set for small construction projects and a set for large construction projects. The next significant change in this order is that beginning Monday, certain outdoor businesses will be able to resume their operations subject to strict social distancing. Outdoor businesses and activities likely pose lower risk of COVID-19, especially where there's strict social distancing. And so many categories of those businesses and activities will now be allowed to resume. There are a number of other changes as well, and I'm happy to answer questions related to that at the end. I do want to remind everyone up front, though, that we must all abide by both the local health orders and the state health orders. That means whichever is stricter controls. In some cases, that's the local order, but in other cases, that is the state order. And the state order does continue to impose limitations on certain activities that the new order might otherwise allow. And so it is important that we adhere to the stricter of both. With that, I'm going to turn it over to Dr. Sara Cody, our County Health Officer.
Thank you, James, and good morning, everyone. Again, my name is Dr. Sara Cody. I'm the Public Health Officer for Santa Clara County. And along with fellow health officers across the Bay Area, today I'm here to describe this new health officer order that we're issuing across the region, and as James mentioned, that will take effect on Monday, May 4th. But before I do so, I want to just pause and recognize just how far we have come and to express my gratitude for the collective sacrifice that has averted a catastrophe in our region. So in preparation for my remarks this morning, I was reflecting and reviewing all that's happened since January. So recall that on February 4th, Santa Clara County had 2 of the 11 confirmed cases of COVID-19 in the entire United States. That's 18%. That's our share of cases on February 4th. And by the end of February, we had documented what we then thought to be the second case of community transmission in the entire country. But we now know that community transmission was already occurring in January, and that the first death in the country was in fact on February 7th and in a resident of our county. So my point here is just to remind us all that here in Santa Clara County, we got something of a head start in this pandemic. But through gradual and collective action, starting with voluntary working from home and culminating in sheltering in place for the last 6 weeks, we have slowed the spread, flattened the curve, preserved our hospital capacity, and prevented many, many deaths. Our county now accounts for less than 5% of the cases in California and just a tiny fraction of the over 1 million cases across the United States. The new order that will take effect next week is designed to preserve the progress that we've made, to continue to prevent a surge in cases, and to gradually ease restrictions, allowing for a few additional businesses and activities to take place. But to be successful, we must ensure that we have a robust infrastructure in place to transition to containment, and our case numbers must remain low to make it feasible. We must proceed slowly as we are continuing to learn more about the epidemiology and clinical severity of COVID, and as we monitor the indicators which I'll describe shortly. So we've learned a lot about COVID-19 since we put the order into place. And most notably, we now know that there's a very significant degree of asymptomatic infection. This means that we need to do even more testing to figure out who is infectious, and even more case and contact tracing to ensure that people who are infectious are safely away from others. We've also learned that it's not just older people and those with chronic medical conditions that may suffer from COVID-19. Recently, and again, thanks to our partners in the media in large part, we've learned many things, including that young and previously healthy individuals have suffered from strokes and other poor health outcomes. So we have much, much more to learn. We also continue to learn from experiences across the world, and we understand that many areas have suffered a sharp resurgence in cases when they have lifted shelter in place too soon. If we move too fast to ease restrictions, the potential for exponential spread could have grave impacts to the health and wellness of our residents as well as to our economy. And of course, a vaccine is still a long way off, and virtually our entire population is still at risk. So our region has developed 5 indicators which we'll be monitoring in our counties and across the region. We'll be monitoring disease activity, healthcare infrastructure to respond to a surge, as well as public health infrastructure needed to successfully transition to containment. But ultimately, our goal is to move from more broad-based mitigation to a more focused approach. So here's what we'll be looking at. 1, whether the total number of cases in the community is flat or decreasing. 2, whether the number of hospitalized patients with COVID is flat or decreasing. 3, whether there is an adequate supply of personal protective equipment to protect all healthcare workers. 4, whether we're meeting the need for testing, especially for people in vulnerable populations or those in high-risk settings or occupations. And 5, whether we have the capacity to investigate all COVID-19 cases and trace all of their contacts, isolating those who test positive, and quarantining the people who may have been exposed. So we've already made significant progress on many of these indicators, and we need to ensure that we don't slip backwards. Our goal is to gingerly chart a course to be the most health protective. We recognize that we can now better measure the health impacts of COVID-19, but much more complex will be to measure the health impact of shelter in place and our other measures. We know that the social and economic disruption of shelter in place have short, medium, and long-term health consequences, but they're, of course, much more difficult to measure. Our plan is to go slow, learn all that we can, and continue to work across sectors and all levels of government to rapidly stand up the infrastructure and systems that we need and to chart the best path forward to protect and preserve the health of the residents that we all collectively serve. Thank you.
As president of the Board of Supervisors, I want to thank each and every resident for all the amazing work that you've done, both to stay at home, to protect your neighbors, and to protect your family. I think we all know that our ability to work together as a community is part of why we're able to move forward today and slowly begin to open up our economy. We have been a national leader in fighting the virus, and now we have to be a national leader in both fighting the virus and protecting our economy. I know, on behalf of all of you, profoundly grateful to the healthcare professionals and all of our essential workers, whether they be truck drivers, bus drivers, the folks who are working in our grocery stores, and all of the amazing volunteers that have been so active in making sure that our communities have the food and resources that they need. So here's what we know. Our work has been effective in flattening the curve, and that we know that sheltering in place and social distancing have worked. I am particularly excited about the opportunity to slowly open back up our economy, and I'm particularly excited that we're starting with construction, because at least in construction, we know there are many, many guidelines that make sure that those job sites are safe, and I think they will have an opportunity to lead the way. We have earned our success, and I want to emphasize that. We have earned our success, and I know we have much to do. And many of you watching or listening have been one of the people who've sent me or Dr. Cody or any number of us emails, and we've gotten them in 3 bunches. Shelter in place, don't let anybody come out, let's stay the course longer. Open everything up as quickly as you can has been the second bucket. And then there's been this middle bucket who's asking us to do this in the most responsible way that we can. And what I'm here to tell you is that recognizing that as a community we have lots of opinions, and I appreciate that we also as a community have to act as one. And that really means being as disciplined as we can about how we open up the economy as carefully and slowly as we can. I've been asking for a long time, it feels like in COVID life, everything's been longer than it was before, for a clear set of indicators that would allow the county residents to track our collective progress in fighting COVID-19. I'm so grateful that we now have those markers, because it allows us to come together as a community, see what those goals are, and meet those goals. I'm just going to close with this thought. You know, I've been asked many times how we're responding. Would we give ourselves a grade, an A, a B, or a C? Here's the one thing I know. There is no place in the entire world I'd rather be than here in Santa Clara County with the people that we have who live, work, play, and worship in our communities as teammates in fighting COVID-19. We are almost there. We are asking for continued patience and continued leadership from all of you. And on behalf of my colleagues on the Board of Supervisors, Supervisors Wasserman, Simidian, Ellenberg, and Cortese, we are really grateful for the leadership our community has shown and grateful to the leadership of our staff. Thank you.
Good morning. My name is David Campos. I am a Deputy County Executive and serving as co-lead Public Information Officer for Santa Clara County's Emergency Operations Center. We're going to take questions at this time, but I do want to note a couple of things. First, I want to acknowledge that our County Executive, Dr. Jeff Smith, and our Chief Operating Officer, Miguel Marquez, are here. I also want to note, as James Williams noted, that the rest of our Board of Supervisors is sheltering in place at home, but I know that they're watching this press conference. For the audience, I want you to know that in this room, we are actually practicing what we preach, and we are engaging in social distancing. Members of the press have pulled one camera that is serving as the camera for all of the media that are here. We also have media on the line, and once we take questions from media that are present, we will proceed to take questions on the phone, from the phone. We also want to note that we have gone out of our way to provide information in different languages. In fact, there are 6 different languages in which we are communicating with our members, with our residents, and we're very proud of that. And there will be an opportunity after the press conference to interview individuals in Spanish, Vietnamese, Chinese, Tagalog. And for the Spanish speakers, we have the Assistant Health Officer, Dr. Elsa Villarino, who will be available. So with that, we will begin to take your questions. And for the viewers on Facebook Live, I will repeat the questions so that you can hear what they're asking.
Can you tell us, this order also references childcare establishments and use of certain outdoor recreation facilities. Can you elaborate which childcare centers will be allowed to open, reopen, and what are some of the protocols that they'll have to face along with those outdoor recreation facilities?
So the question has to do with childcare establishments and outdoor recreational activities. They'd like to provide more information about what is included in that, so I'll turn it over to our County Counsel.
So in response to the question regarding childcare facilities, the order allows childcare facilities, educational recreational programs, and summer camps where there are stable groups of no more than 12 children. Those groups can't have any crossover and any mixing, so that there is a kind of fixed set of social interactions. And that's available at this time for folks who are essential workers or otherwise allowed to work. There are limitations imposed under the state order in this category, and that's something that we will continue to be closely monitoring, because the state order at this time does limit childcare to essential workers. Regarding outdoor recreational facilities, the order makes modifications to the current one. It does allow certain outdoor facilities where there is able to be social distancing, so not physical contact sports or high-touch surfaces, but other types of activities. So, for example, one that's come up a lot would be golf courses. Again, people do need to still abide by restrictions under the state order, and the state has indicated that at this time under the state order, golf courses are not allowed to open. But the local order has been modified to allow those types of outdoor activities where there can be effective social distancing.
Question for Dr. Cody. Dr. Cody, your orders have been criticized as leaning too heavily just on the direct health risk of science and medical evidence about the pandemic and not enough on economic and potential health consequences of reopening. How much should that latter set of considerations weigh in your decisions?
So the question is directed at Dr. Cody regarding her health orders having been criticized by some as being too focused on the health implications as opposed to the economic implications of continuing to shelter in place. So I'll turn it over to Dr. Cody.
Thank you for asking that question. What I can say is that, of course, we can see very clearly what the health impacts of COVID-19 are, how they're impacting families and the healthcare system. What's harder to see is the health impacts of the shelter in place and the mitigation measures. So we're measuring what we know against what we don't know. And I think a very important body of work going forward, and I trust you were far from the only ones thinking about this, is to try to understand and to translate into health outcomes the impact of shelter in place. So to translate what we know has been the extraordinary economic and social disruption, and to understand the impact on health. And then when we understand that, we can gradually change course. Our goal is to carefully chart a course forward that is overall most health protective, and we need to balance the health risks of COVID with the health risks of shelter in place. And we are working hard to understand the short, medium, and long-term health impact of shelter in place. Thank you.
Thank you, Dr. Cody. Any other questions? Yes, ma'am.
Looking backwards, new cases have gone forward, so that has been moving back. Looking forward, we don't really know when this is going to end. But earlier this week, we mentioned that this is still kind of the beginning of the crisis. Can we kind of elaborate on the thinking of that?
So the question has to do with the timeline of this crisis, that earlier we indicated that this is just the beginning stage of the crisis. And so the question is, can you address the timeline? And I'll open up to Dr. Cody.
I wish I could give you a set timeline and tell you when this was going to end. My family asks me, my friends ask me. We don't have a date. We don't have a date when we can all go, back to our normal lives. What I can tell you is, given the fact that we don't have a vaccine is a very long way off, and given the fact that we know that our population by and large is at risk, we are going to need to have protections in place for a very, very long time. What we are hoping is that because we have been extraordinarily successful in our region at suppressing cases, flattening the curve, and decreasing the number of new cases that we have every day, we are hoping to be able to successfully transition to a point where we can be more focused. And if we can both be more focused, and if we can assure ourselves that there's not, chains of transmission that we haven't detected and that we haven't broken, then we can begin to ease up more. But as you can imagine, this is extraordinarily complicated. Among other things, we are not a population that normally stays in place. So folks will travel in and out of our communities, and that will introduce additional challenges. Thank you. The question was whether I anticipate a rolling reopening. What I can tell you is that one of the reasons that we in the region have developed these indicators, and they are in alignment from what we understand the state is developing so far as well, will be able to not only track the impact of the changes that we make, which we very much need to do, but we'll also be able to track and have the public track along with us how our infrastructure is looking for response. So that's our path forward.
And can you also address testing, what Santa Clara County is doing to make testing more available, widely available?
So the question is regarding testing, and as we all know, testing has been an enormous, enormous challenge. The type of challenge has actually changed over time from simply not enough tests to not enough of various components of the test. The current challenge that's emerging is that some labs have capacity, but it's not well matched to where the need is. So one of the current bodies of work is matching capacity to need. That being said, I think that the overall capacity in the system will need to increase, and we see favorable signs that that's occurring.
As everyone is doing, we have some folks participating remotely, so we're going to go and take the first question from the folks that are on the phone.
Hi, question for Dr. Cody. It's been a week since the February 6th death was determined to be related to COVID-19. What have you learned from the contact tracing of that case? How many people have you reached out to? And with what you know now, do you believe the virus was present in December in the county? Thank you.
So this is a question for Dr. Cody from the New York Times, that it's been a week since the February 6th death was first identified as being connected to COVID-19. What have you learned about that death through your contact tracing? And then a specific question of whether or not, based on that, the virus was present in December. So a question to Dr. Cody.
The investigation regarding the county resident who died on February 7th is ongoing. What I can tell you is that this resident worked in the high-tech sector in a company where there was a lot of travel, including travel to Asia. And so our best thinking at this point is that the exposure, we know that we've confirmed that the person who died did not travel in the weeks prior to becoming ill. And so the best information we have suggests that the exposure occurred in the workplace. The investigation is still ongoing, and I don't actually have details about the investigation. And as to when the virus might have first been introduced in the county, we honestly don't know. There's a tremendous collaboration going on between the Public Health Department, the State Health Department, the Centers for Disease Control, and our county medical examiner. And hopefully we're going to get more information, if they can provide it, about the strain that the woman who died was infected with, and see whether that might provide some clues. But it's very difficult, absent having specimens from people who were ill earlier, to really say with certainty when the virus came. Perhaps there's some modelers that could hazard a better guess than I.
Thank you. We'll take the next question from folks on the line.
As a reminder to our phone participants, it is star then one to ask a question.
Is there a next question?
Yes, we can take our next question from Juliette Williams with Associated Press. Your line is open.
Hi there. Following up on death, what can you tell us specifically about what you've learned since then about other people who died of coronavirus in the community? I know you've identified those additional 6 cases. Are there others that you're still looking at, and how do you think that those people became infected? And then if there's anyone from the county who could address the governor's announcement yesterday that he'd like schools to open as soon as July, whether that's possible and what the logistics involved in that would be.
So we have a question from the Associated Press regarding what else has been learned from the February 6th death. Whether other people died from COVID-19. The county has identified, according to them, 6 new cases. So any other information about how other folks became infected and whether we're investigating other cases. And then there's a second question about the opening schools in reference to the comments by Governor Newsom. So I'll turn it back to Dr. Cody.
Thank you for the question. Unfortunately, I don't have a lot of details to share about the early deaths, but we can certainly get back to the press with the information that we have. I think that we need to consult with a medical examiner. What I recall that we originally thought that the first death in our county occurred on May 9th in a woman who was actually our first, at that time, documented case of community transmission, and we now know that there were deaths prior, the earliest being February 7th, again about a week later, and again just before our documented first death. So I'm sorry, I don't have a lot of details, but we're happy to collect them and share them back. As far as commenting on the governor's the governor's comments regarding schools, we've not discussed that internally, so I don't have really anything to add.
As it relates to the governor's comments about schools, I will say this, that again, as I was talking about wanting to be in any place, if I could choose to be here, I'm choosing to be here, and that includes with our governor. And the point I want to make there is I think the governor is really trying to be responsive to what we know one of the challenges of this time is, and that is not having enough feeling like children aren't learning enough, and we don't want kids to fall behind, and make sure they can go graduate and get to the next level of school. I will say that we're going to continue to work very collaboratively with the governor, and we recognize that the governor is using a science-based approach, so I'm not worried about him declaring an opening too soon, but we'll look forward to continuing to work with him.
We'll take one more question, another question from the line. Next question on the line.
There are no additional phone questions at this time.
I know we have one more question from someone in the audience. Go ahead, sir.
Yeah, it was a question for Dr. Cody. Is there any confusion as to where, the governor's jurisdiction on, reopening is your, allowance for some workers to go back on Monday? Is that hinge on anything the governor's office might have to say about that? And how will that work if there is a spike as a result of this? Will there be a pulling back?
So this is a question, he addressed it to Dr. Cody. I'm not sure if maybe County Counsel wants to respond, but it has to do with the relationship between what the governor's authority is and the public health officer's authority here in Santa Clara County. And then also a question about what happens if there is an increase in cases. Would there be any pulling back? So with that, I'll turn it over to our County Counsel, and then Dr. Cody if she wants to respond.
Yeah, regarding the interaction between the state health officer's order and local health officer orders, where there's overlap, the stricter of the two orders controls. So what that means in practical effect is if there is an activity or a business that is allowed to open under the local order that is not allowed to open under the state order, it cannot open. If there is a business that is allowed to be open under the state order but not the local order, it also cannot open. So basically the stricter of the two applies. The state order remains in effect. It remains in effect statewide and sets kind of that baseline standard. But the governor has also made clear that local health officers can continue to take locally based actions that are more protective than the state order. And in many categories, that's exactly what the Bay Area health officers have done, as well as many others across the state. And that also would allow local health officers to be responsive if there is an indication in the future that the indicators, for example, that Dr. Cody mentioned are headed in the wrong direction, that would allow local health officers to take the necessary actions to protect all of us without having to wait for a statewide action. So there is that interplay, there is the interaction between the two. The state has a vital, important, significant legal role to play there, but the stricter of the two controls.
Is that good? I want to be responsive. What I would say is that it's exactly as James mentioned, but my job is to be laser focused on the health of the people that live and work in our county, and to ensure that I take actions to protect the health of everyone who's here. And so if that means that in our county, if we see worrisome trends, if the gradual easing that we are allowing in the next order, if we look at the data and we realize that cases are rising, that hospitals are filling, and that we're struggling to keep up the infrastructure to track them or to isolate cases, then we'll need to pull back a little bit. At the same time, if we were sort of dipping our toe in the water, easing a little bit, and if we look at all of our indicators and see, it's going okay, we can still protect the health of our residents, we can still make progress, then we might be able to ease it a little bit more. So it's a very gradual, stepwise process designed to be the most protective of health overall. Thanks.
Thank you, Dr. Cody. Any other questions? Okay, seeing no other questions, I want to thank you for joining us in this press conference. And again, for those who are participating and joining us through our Facebook Live, we will be back with Facebook Live with Santa Clara County on Friday. Thank you very much. And again, we have different individuals available to provide interviews in different languages. Thank you very much.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.